Welcome to Physician Focus. I'm Dr. Bruce Carlin. From the latest in imaging machines to surgical robots to electronic health records, technology is changing the way physicians practice medicine and changing the way patients receive care. Physicians and hospitals are more and more tied to computers, tablets, and mobile devices, using such tools for electronic prescriptions and even diagnostic procedures. In this edition of Physician Focus, we're going to examine the kind of impact technology is having on healthcare and what it means for the physician and the patient. With me for our discussion are two members of the Massachusetts Medical Society's Committee on Information Technology. Dr. Thomas Sullivan is a board-certified cardiologist and currently is the chair of the Partners Health System Confidentiality and Security Steering Committee, as well as the Chief Privacy Officer and Chief Strategic Officer of DrFirst.com, an e-prescribing company. He is a past president of the Massachusetts Medical Society. Dr. Hugh Taylor is a board-certified family physician in a group practice in Hamilton, Massachusetts. He is a past president of the Massachusetts Academy of Family Physicians and currently serves as a vice chair of Medical Society's Committee on Information Technology. Welcome to you both.
Thanks, Bruce. It's nice to be here.
Thank you. Thank you for having us, Bruce.
This is an important topic. What exactly do we mean by health information technology or health technology?
It's a pretty broad area. We are being basically anything to do with electronics and computers that we use to help us in healthcare, which includes electronic medical records in the office. It includes physician ordering in the hospitals. It includes electronic prescribing. It includes mobile devices that we use to keep track of patients really wherever we are.
I would agree. Information technology, though, is different than the traditional technology that we've used in medicine to diagnose and treat patients. Information technology, includes the language, the software that is able to go on this hardware and these other mobile devices. So it's a different kind of technology that pretty much everybody is familiar with nowadays.
But more involved with the communications of what we're finding out with our other technologies.
Right. More involved with communication. Some people consider the connected computer as just a sophisticated telephone. But it can also be a television, as web broadcasts, as video conferencing, all of this sort of stuff. And we use these tools now to better interact with and treat our patients.
I'd say the emphasis is on the information piece, because there are electronics for a lot of other things, but we're talking about mainly the use of information here.
And how we share it.
How we share it,
how
we access
it. So how do we share it? And are we really good at it now?
Okay. Though most of us in Massachusetts, most doctors now, I think, are actually using electronic medical records. Which doesn't mean we all enjoy it. This is an industry that I would say is still in a fairly early stage of development. So, yeah, it has a lot of positive features. It's interesting that doctors may complain about use of these records, but once doctors have started to use them, they never want to go back to paper again. So there are clearly advantages to using an electronic record that are worth keeping up with, despite all of its difficulties for us.
And getting back to your original question, how do we share this information? That depends on a number of factors, because privacy and confidentiality are very important considerations in who we share this with and how easy it is to access it. But one of the great advantages of information technology is with the right security protocols and the right permission, you can access information from other doctors and hospitals. Right now, it's easiest to access information from doctors and hospitals that are in your own system. Like, as for instance, if you got treated at the Mayo Clinic or somewhere in New York and you're coming to a doctor in the Boston or Massachusetts area, it's a little tough to get that information, online. The old-fashioned way was you send a paper in the mail, or you fax it, which still lots of people do. But now this has the promise of being able to get it in almost real time, especially if the doctor and the hospital are integrated.
The key to that is the promise of doing that. And what we're often seeing here are the growing pains of getting from snail mail to online. Right now, a lot of us suffering from the growing pains are getting faxes, which we then download into our system and then have trouble retrieving them. So there's a lot of steps between snail mail and seamless online. How is that progressing?
Well, as with most things in computers, you can imagine things working better than they do. In fact, there's no question. I said that this has been a great deal of progress. I mean, Tom was talking about getting communications from outside, but I think that one of the main virtues of electronic record is just being able to access information that's in my own files from past years. Back some of us remember back in the old days when we had paper records, when if you want to look up something that happened to the patient 5 or 10 years ago, it was hard to find. It was stuck somewhere in the back of the paper record. The electronic medical record it's easy to find. The access is right there, and that's true if you're looking for a past medication that you may have prescribed someone for depression. If you're looking for a bad reaction the patient had years ago. A specialist who they saw a few years ago, can't remember who it was. All that stuff is now at your fingertips. So it's easy to get information that you've put into the record yourself and stored away. And I think that's one of the great virtues of the record.
I would agree. The biggest asset of this is being able to search within your own system the patient's past history of maybe there's a drug allergy that they forgot they had, or maybe there's a drug that they were on before and they can't remember the name. They just remember it didn't sit well with them, or it was really good, and they just can't. So the ability to go back into the past history right within your own system is great. But in addition to that, the ability to access information online also brings an added benefit, because now we have a fairly well-developed electronic prescribing network. So you can see, in many cases, what other doctors prescribed, especially now because many patients go to multiple doctors. It's no longer true that you have one family doctor and that's the only one you go to. People often will go to a specialist, and you want to know for the patient's safety what other drugs are being prescribed, and that's just the tip of the iceberg and the benefits.
It's true that the prescribing part of it is one of the very helpful pieces of the electronic record. It allows me to communicate two ways with the pharmacy. So I can now send electronically what I want to prescribe to the pharmacy, which I tell you has cut to just about zero errors. Like in the old days of writing prescriptions, it was not at all uncommon to have the pharmacist have a hard time reading my handwriting. I hate to say it's not that great. So
you passed that course.
Yeah, exactly. But with electronic records, they know exactly what I'm saying, and they also feed back to me whether they got the prescription. They also will send back things like saying, the patient wants a 90-day supply instead of a 30-day, things. So we actually have a two-way communication with this system.
I was thinking from my point of view a lot in some of the big systems, getting that old data into the record. A lot of the complaints that you hear from your physicians getting onto the new electronic medical record is that it's their data entry burden, that the physicians. So when patients hear about the physicians cursing at their new electronic medical record, a lot of it is just they're putting that in. But once in, as you say, it's really good stuff.
Yeah, that's absolutely true. I had the unique experience of, in my own local community hospital, I had a patient who I couldn't see the records that were older than 5 years on the computer. But 25 years ago, this patient went to one of the big downtown Boston teaching hospitals, and I'll be darned if I wasn't able to see a copy of that X-ray from 25 years ago.
How did they get that in? Do they have their people doing the data entry?
Especially in Boston, some of the leading hospitals there were real pioneers compared to the rest of the nation in computerizing, or we'll say digitizing, medical records. So it might have been an old image of an X-ray or just a report of an X-ray. So several of the hospitals in Boston really were pioneers, and so they have stored those records all those years.
They probably still have the old DEC computers that they stored it on, too. So what other things do you find in terms of tracking patients that the new health information technology? You've got the prescriptions, you've got the allergies, you've got the
what we're using the computer for a lot right now, increasingly really, is to make sure that patients get the kind of parts of their care that we know they should be getting on a regular basis. For instance, if you're looking after someone with diabetes, you know that they should be getting their eyes checked once a year. They should be getting certain blood tests on at least an every 6 months basis. They should be coming in for their blood pressure checks. Now, so what we're using the computer for is to run reports. We see who has forgotten to come in, who's been away in Florida, who, for whatever reason hasn't come in, and we can actually reach out to those folks and invite them in, which before was hard to do. It was hard to keep track of all that.
And we were, the other downside of that also was that we felt responsible for things that we really couldn't respond to. But now we've got a better way of responding to it.
And there's a couple of other things in terms of tracking and just taking care of patients where this information technology makes a significant difference. There are things called alerts, and there are others called reminders. Now, that might seem like jargon to some people, but people know an alert means, hey, can you pay attention to this? And so some of the more sophisticated software programs will pop up a little thing that says, like a common one is an allergy alert. Oh, this patient is allergic to penicillin. You sure you want to prescribe that penicillin? A little alert. And then there are others, reminders. This patient is due for a mammogram. Not. So
while you're in some other part of the record, up pops a thing that says,
or it could be you're sitting in front of the patient and, your computer's here and, you're just going over to check things. There's another thing that's not only does this have the potential for improving the care of the patient, but also potentially reducing the cost of care. And that's a big topic right now. Reducing to electronic medical records help cut the cost of care. But one of the areas that's clearly been proven is when you go to prescribe a medication, if that patient's insurance company doesn't have that medication on its preferred list, what they call a formulary, it may cost a lot more than the drug that's on the preferred list, or what's called a generic drug rather than a brand name drug. And so
we get an alert.
Exactly. You get an alert or a reminder that, hey, this patient's insurance doesn't pay for that drug. Here's a cheaper one that may be the equivalent. And so those are helpful because we don't look at patients and say, oh, this one's on Blue Cross and this one's on somebody else or Aetna or whatever. You can't remember all of that, nor should you. But the information technology and the electronic prescribing and health record definitely help, and everybody benefits there. The patient benefits, the insurance plan benefits, the pharmacy benefit manager.
Up and down the line.
And it's a lower cost. It prevents those callbacks from the pharmacy and that kind of thing.
In a certain sense, I mean, there are many complaints about physicians in their growing pains staring at their computer and cursing and doing other things. But some of that is actually improving patient care because those reminders are coming up and it's on the early stages yet. The jury may still be out, but I think the trend is very clearly we're not going back, and some of these things are truly critical.
Oh, it's no question it's a real advance. I mean, you mentioned the complaints you hear from physicians about this, and my feeling is that I've twice now I've been through the process of starting out a new computer system. We had one about 10 years ago, and then about 2 years ago we switched to a new one. And each time it does take a while to learn how to use the system. And during that time, it is distracting. You're in the room with the patient. You're trying to pay attention to what the patient's saying. And it's a little distracting to be trying to figure out the computer at the same time. And it takes a number of months before you do that. And so that's
once you do it.
Once you do it and you get some facility, then it's at least is tolerable, and it's clearly worthwhile.
Yeah, and I would agree with that. There is a learning curve for these things, just as there is for any kind of sophisticated technology. But losing eye contact with your patient is a very great danger, and the patient-physician interaction is so crucial. And that relationship is so crucial. You don't want to be going into a doctor who's turning the other way and typing on a computer or dictating into the computer and then turns back to you. And you want to have that eye contact. It's so important because the physician is one of the world's experts in nonverbal communication. Patient may be telling you something, but you look at their eyes and you look at their face and you look at their body language, and you can see between the lines. Every doctor knows that.
And it's the fun part of medicine.
It is.
It is.
Yeah.
So if you lose it, that's terrible.
Yep.
Yeah, and that doesn't go away. And it's kind of a new skill that the physicians have to learn in this day and age is how to maintain the eye contact, really how to draw the patients in to share what you're doing on the computer. You can show them when I'm with a pediatric patient, showing the child and the parents the growth curve works very well, or reviewing lab data together. Those things are ways that you can actually show the patient the value of the record.
Well, you hit upon some of the interesting benefits to patients, so that actually having that screen there and being able to share information. I'll often toggle to an information database and share articles with the patient right there on the screen, print them right out, and do stuff like that. But
sure,
what else are we going to be able to do for the patient?
Well, the other thing I do is I do get most of the consultants I refer patients to are able to send me their reports electronically, which are up right there on the record. And a lot of times patients will come in, they say, "Did you hear back from Dr. So-and-so? What did he say?" So we can review, we can read down the consultant's note together.
That is a great attribute of the computer. That is fantastic. I do that so many times. A patient come in to me and say, "Well, I saw Dr. Jones 3 weeks ago, and he said this, that, and the other thing. And, I don't take notes, and I don't remember exactly what he said. Yeah. Did he communicate with you?" And I can pull up the screen and I say, "Here's exactly what he said in his record," and they can see it on the screen, or I will show it to them.
And the interesting part of that one is sometimes it's a little different than what the patient remembered.
That's exactly right.
Yeah.
That's exactly right.
Right.
So they see it on the screen, and they sometimes they'll say, "Wow, that's really good." And and I will turn a screen towards them, and I may show them on an X-ray where their pneumonia thing is, or where this little spot in their lung that they have to have. They have to have a biopsy, and they might say, "Oh, that's small, or that's big, or I can't see that." And like if somebody comes into me and says, "I've got palpitations," and that sort of thing. So frequently, I'll just be able to show them an electrocardiogram, and I see that extra beat you have there. That's the one. That's the one you're feeling. Or in a cardiologist, it's the beat after the extra beat
that you actually feel. What about these patient portals? What's happening with that? Can you describe that and say whether you're using them?
Well, patient portal is a great idea. Again, it's one of these things that hasn't quite reached prime time, in my opinion. Other than some systems, like the one that Tom is with, Partners does do that. But I think that in our system, for instance, we're trying to get to the point, but it just is not functional yet. But the idea of the patient portal is to allow two-way electronic communication with the patient, so that when I have a lab report, I can send it to the patient by email, and so the patient can email me questions about their health. So that's, I think that's clearly going to be an advance when it gets here.
And the trick on that is the security.
Yes.
Tom, you had, when we were talking before the show, you had a wonderful way of describing the spectrum of security problems.
Sure. People don't often understand the difference between privacy, confidentiality, and security, and they often mix them together. But they're actually three very separate things. And one of the ways I sort of try to teach other doctors and patients or an audience, the ideas of privacy, confidentiality, and security have been around for thousands of years. But one way to think about how they came about is think of the personal pronouns in languages. And it's not just English. It's the personal pronouns I'm thinking of are I, we, and them, or, you can do singular and plural, but I, we, and them. I refers to the privacy rights. Every patient determines what they're going to share or not share with whoever it is, whether it's a doctor or your spouse or your brother or whatever. That's I, me. We, us. There's where confidentiality comes in. So you say, you know what, I'm going to share this really sensitive information with you, and only you, or only you and your colleagues, and I want you to keep that confidential. It's among us. But I know that in the contemporary world today, we have to share this information with a lot of people, like the pharmacy and like Medicare or my insurance. That's where them comes in, and the them means more than two. It's more than two people. It's a third party. So security is the set of rules that helps protect your confidentiality and privacy. So it's a set of rules when you have to share the information among a number of people. So it's I, we, and them. Privacy, confidentiality, and security.
And it gets back to Hugh's problem with the patient portals, is that we're not so secure as we would like to be.
Well, that's why it's hard to design these things properly, because they really have to be secure.
The other thing that's happening is the federal government has given some money to the system to promote patient portals. So the federal government sees the importance, and they have a number of projects in mind that are being funded out of Washington to not only fund the idea of patient portals, but also fund the idea of free, secure email, primarily directed towards healthcare communications between providers and consumers. So patient portals are still in their early phase. They have some difficulties, but the federal government thinks it's a good idea, and you can bet that if they give some money, the hospitals and the doctors and the health record vendors will say, we'll do it.
Yeah. Can you follow on with that? There's some real issues now with security, and I'm wondering, particularly in the prescribing of opiates and controlled substances, you would think that this would be one of the first places that we tackle it. What's happening there? How do you apply these principles of security and privacy in that? While
do you want me to?
That's your area.
Sure. So first of all, the relatively modern era of privacy and security sort of started with the federal law in 1996 that we know as HIPAA. Even though it was more about portability of insurance, privacy became a real federal regulation at that time. So there's a whole series of complex rules about how you have to protect a patient's privacy. And those rules have technical as well as administrative components. And now there's the more recent issue of we've been able to prescribe electronically for a number of years now. In fact, Massachusetts has been number one in the country in terms of the number of prescriptions sent ever since the program started. But controlled substances like narcotics, analgesics, certain sleeping pills are a more dangerous class and subject to abuse and addiction and that sort of thing. And the Drug Enforcement Administration of the federal government is...
We're coming really close to the end here. And
okay.
Okay. I know you could go on a long time on this.
Anyway, there are new rules that are tougher when it comes to...
So it's harder to get the security.
Yes.
Do you have any parting wisdom for patients about health information technology? Hugh.
I just say that what patients have always wanted in a doctor is someone who really cares about them as a person, someone who takes the time to find out as much as they can about the patient, and someone who has good judgment. And the electronic medical record is not going to remove the need to form a strong relationship between the patient and doctor. It's not going to take away, not going to substitute for good judgment. But what it does do is it makes it easier for the doctor to get the information together, to really get to know the patient well, to have instant access to that information. So patients really should be happy that their physicians are using electronic records, even if it's sometimes a struggle.
Again, I would agree with Dr. Taylor, and this is an exciting time. It's an exciting time to be in medicine because we have these new tools that potentially make medical care, health care safer, better, and hopefully less expensive. And these new tools are a great asset. They require some learning, but I think everybody benefits, especially patients.
Well, thank you both for coming. This has been very informative. Your accumulated knowledge is incredible, and I'm sure we could have gone on for a few more hours talking about all the aspects of health information and health information technology. For more information on technology in healthcare and what it means for you, visit the websites listed at the end of our program. And to view past editions of Physician Focus featuring a variety of health topics, visit our website at physicianfocus.org. Thank you for watching. I'm Dr. Bruce Carlin.
I'm Dr. Tom Sullivan.
And I'm Dr. Hugh Taylor.
From the latest in medical testing to ordering prescriptions, health information technology is changing the way physicians practice medicine and patients receive care.
Simply defined, health information technology means using computer hardware and software to securely store, retrieve, and share a patient's medical information.
One of the biggest benefits of this technology is the ability to create an electronic health record, or EHR, a digital version of the patient's health information that formerly was stored on paper and in many cases still is.
An electronic health record offers faster access to health information and reduces the risk of medical errors, such as potential drug interactions from multiple prescriptions.
An EHR also offers the possibility of better and faster communication and secure record sharing among all your healthcare providers, which results in better coordination of care and often eliminates unnecessary tests and procedures.
For more information on how health information technology is improving medical care for patients, visit healthit.gov.
I'm Dr. Lauren Smith. Cardiovascular disease is the leading cause of death in the United States. Each year, 2 million Americans suffer a heart attack or stroke, and more than 800,000 die as a result. Millions more become disabled. The human and financial costs are high and continue to rise. The good news is that many of the risk factors for cardiovascular disease can be prevented or controlled. The Million Hearts campaign is a national effort by federal, state, and local public health officials to reduce the risk of heart disease and stroke. The campaign emphasizes the ABCs of health: aspirin therapy, blood pressure control, cholesterol management, and smoking cessation. These are proven, effective, and inexpensive ways to reduce risk. I urge you to make your commitment to the Million Hearts campaign. Talk with your doctor about the risk you might have and take the appropriate steps to good health. For more information, visit millionhearts.hhs.gov.